Welcome back in. June is Men's Health Month, and we're talking about health topics that are common this afternoon with urologist Dr. Michael Bivens. And thanks for joining us virtually, Doc. How you doing?
I'm doing well. How are you?
I'm doing good. I'm doing real good. Okay, Dr. Bivens, I guess the first thing is low testosterone. Tell us about this real quick.
Well, I think it's really, we're now paying a lot of attention to it. And in low testosterone, we know that as men get older, their natural testosterone will drop off. And as it starts to drop off, they start to develop symptoms. Now, I think historically, men have just settled in and accepted that that's what would happen. But now, men they're wanting to feel better, feel younger. So the typical symptoms that men will have is tiredness, fatigue, and sort of that fatigue that they just need to drink a lot of caffeine, and it just seems to not help. The other party, they may decide, well, I want to get up and start working out, and they just can't lose that weight. So they have weight gain, in particular around the midsection area. They also will start having just low desire, low concentration, and low manly function. And so those are typical symptoms of a man that has, low testosterone. Now, the way we evaluate a man, we do a good physical exam and history, and we check blood work. And that usually will give us the telltale sign. They'll have a low testosterone level. And interesting enough, men also may have a higher estrogen level. And that especially when men get more fat and they have more fat around their waist, that they will start converting even the testosterone they have to estrogen. So that becomes sort of, when we are evaluating patients, I think it's important for people to ask those questions. Hey, if they're going to the doctor, if they're getting their testosterone checked, hey, what about my estrogens also? Because you can treat the testosterone, and the estrogen still may be a problem. Now, how we typically treat that, there's multiple ways to treat it. You can do, testosterone injections. You can do gels. They have a new pill form out. You can do implants. One thing I will say in my younger guys, they have to be careful about, and I hope they're listening to this, be careful about taking testosterone, because in younger guys that want to get, out there and they want to lift weights and get more muscular, the problem, the side effects of higher testosterone is that it will shut down your sperm production. So when young guys come in, they want to just get a little more beefed up. I have to tell them, you may want to think about that as it comes to your fertility and having children.
Just real quickly, I've dealt with prostate cancer in the last year or so. Just kind of give people what they need to know about this as quickly as you can for us. But thank you.
Well, yeah, prostate cancer, it's important to get screened, and the earlier we catch prostate cancer, the better your chance of surviving, and you know that well. Mm-hmm. If we can catch it real early, then we can cure prostate cancer. What happens is patients will come in and say, well, doc, I'm not having any symptoms. Well, why do I need to get checked? And that's a big fallacy, because there are no symptoms early on. Men are out there doing a normal job, whether that's covering the news or whether that's delivering the mail, whatever they're doing, they're just living their normal life. And if they have it, that's when we want to catch it. The way you screen those patients, you will check a blood test called a PSA, and you'll do a digital rectal exam. And you should do them at the age of 50, unless you are at higher risk. And those people that are at higher risk are your African Americans and your patients with a family history of prostate cancer, in particular on their father's side. And at that point, they should get it at the age of 40.
Sounds good.
And the last thing I want to say.
Okay.
Oh, I'm sorry.
Go ahead.
The last thing I want to say is know your PSA. Don't assume your doctor check it. You should know it and ask, what is my PSA? And people are going to find a lot of times that they don't check it. And it should be 2.5 or less for men under 70.
Hey, good information right there, Dr. Bivens. We certainly do appreciate it. And we hope that the guys out there are paying attention and go get it checked. We'll talk to you soon, okay? All right.